Something, and I think of this almost on a daily basis. When I look at my co-residents, so many of them came into residency either married or with kids, or
Mhm.
they just got engaged or just got married, or they just had their first kid. And I'm not married, not planning on being married anytime soon, not planning on having kids anytime soon. But I feel like there's no way I could do residency. Having a family, a significant other, having kids, and having that responsibility. How have you managed to juggle being a family man, having kids? You had kids for the first time, right, in residency,
In
in
fellowship,
fellowship,
right.
out of all
Yeah.
places in the timeline of training. What's that been like?
Yeah, I mean, it's sort of like the gas kind of expands to fill the room type of situation. I remember my first class in med school, it was biochemistry, and the professor was like, "Well, yeah, the exam is going to consist of 200 PowerPoints." And I was like, 200 PowerPoints? Did she say something wrong? Did she say 200? And it was in fact 200 PowerPoints, and each of them were like 60 to 150 slides long. And I was like, there's just I don't think I've ever read so much information, and much less for an exam. And you just surprised by what the human mind can do, the human brain can do, right? So it's sort of a similar scenario where like the more you're forced to do, the more you actually end up doing without even knowing. Um, to me, it was crucial to have a phenomenal life partner, and my wife just helped out a ton with the kids. And whenever I had surgeries, she would wake up, and if the kids were crying or something, and she would let me sleep so I wouldn't fall asleep during surgery and that sort of stuff. But the reading and the studying, you just have to find slots in your day where it's just where you can fit some self educating and into place. And sometimes it's staying an extra hour after you're done with clinic, or sometimes it's coming in an hour earlier into the office and reading. And obviously, I'm not the only one to do this, and a lot of people have done it in the past. And it's possible. Is it harder? Yes, 100%. Is it doable? Of course.
You rose to the challenge. Since you were here in the U.S. doing residency and fellowship, did your family from the PR ever come to visit you guys or help raise the kids over the past couple of years?
Right. So before we had kids, they visited us, a couple of times. When we had kids, they visited us a lot. So essentially every month. So initially, either my mom or my mother-in-law were sort of essentially living with us for like 2 or 3 months at a time. And that helped tremendously because, as you know, I have twins. So it wasn't just leaving my wife with one kid, it was with two kids. And if we didn't have someone there to help, it would have been really hard. And on a fellow salary, you can't always hire someone to help out. And I mean, having family come in and help because they weren't around, of course, it made it possible.
Yeah.